Imagine walking into a clinic at the age of 72, feeling completely fine, and walking out with a diagnosis that changes your life forever. Not because you were sick, but because of a test you probably didn't even need. This happens more often than people realize, and today, I'm going to tell you something that might surprise you. There are certain medical checkups that, after the age of 70, I personally would think twice about, or even avoid completely, unless there's a very clear reason. Now, before you misunderstand me, I am not against medical checkups. Regular healthcare saves lives. It catches problems early. It gives peace of mind. But here's the truth we don't talk about enough. After a certain age, more testing does not always mean better health. In fact, sometimes it leads to unnecessary stress, overdiagnosis, harmful treatments, and a lower quality of life. So in this video, I'm going to walk you through 5 medical checkups that I, as a doctor, would be very cautious about after 70. Not to scare you, but to help you make smarter, more informed decisions about your health. Let's talk about it honestly and calmly. Routine, full-body CT scans. What it is. A full-body CT scan is a detailed imaging test that scans your entire body looking for tumors or abnormalities. Why it's a problem. It sounds amazing, right? Scan everything and find problems early. But here's the issue. These scans often find things that look dangerous, but are actually harmless. We call these incidental findings. Real-life example, I once had a patient, perfectly healthy, who did a full-body scan, just to be safe. The scan showed a small spot on the lung. What followed? Months of anxiety, repeat scans, even a biopsy. In the end, it was nothing. But the emotional stress? Very real. Radiation exposure, repeated testing, and unnecessary procedures that can actually harm you. Practical advice, only get imaging tests when there's a clear symptom or medical reason. Not just for peace of mind. PSA screening for prostate cancer in certain cases. What it is? A blood test used to screen for prostate cancer. Why it's a problem? After 70, many prostate cancers grow very slowly. So slow that they will never cause symptoms in your lifetime. Real life example. A 74-year-old man gets a PSA test. It's slightly elevated. Now he's sent for biopsies, maybe surgery or radiation. But here's the truth. That cancer might never have affected him at all. Hidden risk? Treatments for prostate cancer can cause urinary problems, sexual dysfunction, and reduced quality of life, all for something that might never have been dangerous. Practical advice. Discuss with your doctor. If you're healthy and have a long life expectancy, it might still make sense. But routine screening without a conversation? Not always necessary. Colonoscopy. After a certain age and history, what it is? A procedure to check for colon cancer or polyps. Why it's a problem? Colonoscopy is a valuable test, but after 7-5, the benefits often decrease, while risks increase. Real-life example, an older adult goes for a routine colonoscopy, no symptoms, just routine. During the procedure, there's a complication, a small tear in the colon. Now, instead of prevention, we have a medical emergency. Bleeding, perforation, complications from sedation. These risks are small, but they increase with age. Practical advice. If you've had regular normal colonoscopies before and no symptoms now, you may not need to continue. Always individualize the decision. Routine mammograms. In some older women, what it is? A breast cancer screening test using x-rays. Why it's a problem? Just like prostate cancer, some breast cancers grow very slowly in older age. Screening may detect cancers that would never cause harm. Real-life example. An 80-year-old woman undergoes a routine mammogram. A small tumor is found. Now she faces surgery, possibly chemotherapy, but the treatment may be more harmful than the disease itself. Overdiagnosis, unnecessary treatment, emotional burden. Practical advice. If you're healthy and active, screening might still be reasonable, but if you have other health conditions or limited life expectancy, it's worth reconsidering. This is about quality of life, not just quantity. Routine heart stress tests, without symptoms. What it is? A test that checks how your heart performs under stress, often using a treadmill. Why it's a problem? In people without symptoms, these tests often lead to false alarms. Real-life example. A 71-year-old man, no chest pain, no issues, does a stress test just to check. The result is slightly abnormal. Now he's sent for angiography, maybe even stents. But guess what? He never had a real heart problem to begin with. Hidden risk. Unnecessary invasive procedures, complications, and anxiety. Practical advice. If you don't have symptoms like chest pain, shortness of breath, or fatigue, you probably don't need this test. Focus on lifestyle instead. Walking, diet, blood pressure control. That's what truly protects your heart. So what's the big message here? After 70, healthcare is not about doing more tests. It's about doing the right tests. Because unnecessary screening can lead to stress, unneeded treatments, and sometimes more harm than good. Your health decisions should be based on your overall condition, your life expectancy, your personal values, not just routine. If there's one thing I want you to take away from this, it's this. Don't be afraid to say, do I really need this test? What happens if I don't do it? Good medicine is not just about finding disease. It's about protecting your life, your comfort, and your dignity. If this video helped you think differently about your health, share it with someone you care about. And remember, sometimes the best decision is knowing when to do less. Take care of yourself, and I'll see you in the next one.